Hey guys, Ashley with Amare. So, few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, Ashley with Amare. Hi. Today we are talking about frozen shoulder. So frozen shoulder is a condition where you literally can't move your shoulder. When you try to lift it, the whole joint goes like this. Now you guys can't really see. Like this. You can't lift it this way. When you try to lift it this way, the joint goes like this too. Your shoulder joint is stuck. It's frozen, right? So let's say this is happening. You go to the doctor and they're like, oh, you have frozen shoulder, go to PT. But no one explains to you what's going on in your shoulder, right? So frozen shoulder can be caused by a lot of things, by an injury, we're going to go through a list because I have 2 articles here. But frozen shoulder can be caused by a lot of things. There was a nice little list. All right, when I go through the articles, as I always do, I'm sure I'll find it. But it's one of those things where people are just like, oh, I've had this frozen shoulder for 6 weeks, 8 weeks, a month, a year, and it just doesn't get better, and I don't know what to do, and I've been to PT, and I've done steroid injections. I've done, cortisone injections, all kinds of stuff. It's not gonna work because pathologically and physiologically, that's not what's going on in your shoulder. So when you have a frozen joint, now it can be, yes, it happens a lot in the shoulder, but I've seen it happen in the knee, I've seen it happen in the hip, and we get rid of it. Here's why. Frozen shoulder is an inflammatory condition. It is inherently lymphatic. The key to getting rid of frozen shoulder is getting rid of the inflammation. The problem isn't the tear or whatever it is that's going on in there. A lot of times it isn't even a tear. It's some sort of an injury that happens. And the swelling is what's causing the frozen shoulder issue, not a tear, a rip, things like that. That could have been the initial cause for the swelling, but the reason the shoulder is frozen is because of the swelling and inflammation. And this is one of your central areas of all your lymph nodes. There's a huge lymph node bed under your armpit. And there's also lymph nodes in the back of the shoulder joint as well. So when we're talking about frozen shoulder, we're talking about swelling. We're talking about lymphatics. We're talking about inflammation. So let's get into this. So I have a lovely little article from the clevelandclinic.org. I don't know why I have an accent. It feels right. The clevelandclinic.org, and it's literally called frozen shoulder. So if you Google frozen shoulder, Cleveland Clinic, you'll find the article. All right, so it says, frozen shoulder is a painful condition in which the shoulder becomes stiff and inflamed and movement becomes limited. What is frozen shoulder? Frozen shoulder, also called adhesive capsulitis. Now, guys, we know this from all my other videos that, at the end, when it says itis, that means swelling. Arthritis, capsulitis, sinusitis. Oh, and fun fact, did you know that Dr. Emil Vater created manual lymphatic drainage to help get rid of sinusitis? That's originally why he created it, to treat sinusitis. So manual lymphatic drainage, again, if we don't know, is a medical modality. It's a manual manipulation of the skin. In the United States, it's considered a massage technique, but it's not actually massage. We're not manipulating or rubbing or doing any of this. It's this gentle extremely technical, extremely superficial skin movement. We're moving just the skin. So it's this super, super, super light pressure just so the fingers grip the skin in a specific pathway following our lymphatic map in a specific sequence to get the body to reabsorb swelling. So we're working directly with the hair-thin lymphatic vessels. They are literally as thin as a hair and lie a hair deep just beneath your skin. So, adhesive capsulitis is a painful condition in which the movement of the shoulder becomes limited. So like I said, a lot of times it'll look like when you go to lift your arm, the whole shoulder does this. Like the joint itself doesn't move. Or when you go out to the side, it does this. It's like stuck, the whole joint. So that's what that looks like. Frozen shoulder occurs when the strong connective tissue surrounding the shoulder joint, called the shoulder joint capsule, becomes thick, stiff, and inflamed. The joint capsule contains the ligaments that attach to the top of the upper arm bone, humeral head. So they go like this. They connect in here to like the arm itself in here. To the shoulder socket, glenoid, firmly holding the joint in place. This is more commonly known as the ball and socket joint. I have pictures for you guys, don't worry. The condition is called frozen shoulder because the more pain that is felt, the less likely the shoulder will be used. Lack of use causes the shoulder capsule to thicken and become tight. Hint, hint, that thickening is your lymph fluid or your swelling thickening because you're not pumping that lymph node bed under here. It's not getting any movement. Your lymph nodes pump and your lymphatics pump by moving your skin. That's how the system is designed to work. Your body inlaid this like spiderweb network of lymphatics, right? Let's take a look here. This spiderweb network of lymphatics, your body inlaid this into your skin. So if we're not moving the skin and we're not moving the joint and we're not getting all of this moving, the swelling's going to become stagnant like a swamp and thicken and become really tight and stiff and hard and sludge-like, and it's gonna bind everything up in there and become fibrotic. So, okay, lack of use causes the shoulder capsule to thicken and become tight, making the shoulder even more difficult to move. It is frozen in its position. Here we go. So, who is at risk for developing frozen shoulder? Adults, most commonly between 40 and 60. That's not accurate. I have clients with frozen shoulder all the time that we get rid of in like a month. And like, I mean, completely stuck, like can't even move the entire upper part of their arm. And with manual lymphatic drainage, getting that inflammation down, freeing up the skin, freeing up the joint, getting all that swelling to drain back into the body out of the joint capsule, they're able to completely move it, have full range of motion, no pain, completely decongested. Manual lymphatic drainage is decongestive therapy. Your shoulder is congested with swelling and it's becoming thick and stagnant like a swamp, pulling on all those ligaments, causing that shoulder not to be able to move and causing a lot of pain within the armpit, in the actual joint capsule itself. So it's in the armpit, it's in the front of the shoulder, the back of the shoulder, the point where your shoulder meets your arm. It's this whole area in and around and on top of. But we decongest that area. So it's not most commonly between 40 and 60. I have seen it in 20-year-olds. I have seen it in 30-year-olds. I have seen it in every age range in between. Even kids. Kids can get frozen shoulder too. Because again, frozen shoulder is just excessive, stuck, thick swelling, congesting that joint. So it's not just an age thing. Gender more commonly in women than men. That is also not accurate. I work with a lot of like bodybuilders, UFC fighters, recovery people, soccer players, like people that are using their bodies constantly. I see it in men a lot too, like a lot. So that's also not accurate. But I mean, maybe this is, the Cleveland Clinic's generalization, but I'm just saying it can happen to anyone, any age, anytime. It's not like a genetic condition or anything like that. And we'll get into that a little bit more. Recent shoulder injury. Any shoulder injury or surgery that results in the need to keep the shoulder from moving. Why? Because again, if you have an injury and you have swelling, your body's lymphatic system is the only thing responsible for getting rid of swelling. So if we're not letting that lymphatic system and skin and joint move the way it normally would, and we're impeding it, none of that swelling is going to move. It's a system that needs movement in order to move the swelling. It doesn't have its own central pump. So it's not like the heart where your blood's just going to pump through your body even if you're laying down and not moving. Your body needs some sort of skin movement, mobility, movement itself to help get rid of the swelling and pump it out. It's like one of those little like pumps that you see on a farm for water. It needs that to get the water up and out, to suction the water up and out, and then you pee it out. So any situation where you are bracing the shoulder, where you have it in a sling, a shoulder wrap, things like that. Examples include a rotator cuff tear and fractures of the shoulder blade, collarbone, or upper arm. Diabetes. Between 10 and 20% of individuals with diabetes develop frozen shoulder. Swelling. That's why, because of the swelling issue. Other health diseases and conditions include stroke, again, swelling. Hyperthyroidism, again, swelling. Your thyroid is a lymphatic organ. It is one of the 7 lymphatic organs. It is a gland. It's a lymphatic organ. Hyperthyroidism, so underactive, overactive. Parkinson's disease and heart disease. Stroke is a factor of frozen shoulder because movement of the arm and shoulder may be limited. Again, it's that motor, right? It's that motor for the lymphatics. Why other diseases and conditions increase the risk of developing frozen shoulder is not clear. Well, I just cleared it up. It's the swelling that comes with those conditions. This is just a swelling problem. So symptoms and causes. What are signs and symptoms of frozen shoulder? The freezing stage. So there's 3 stages. Just like with lymphatic fluid, before it becomes fibrotic, there are 3 stages. So the freezing stage. In this stage, the shoulder becomes stiff and painful to move. It's stiff and painful because there's so much swelling impeding the joint and the ligaments, you can't move it. And then when you do, you're feeling that pressure, that burn of the swelling. The pain slowly increases because the swelling is increasing. Just saying. The pain slowly increases. It may worsen at night. Inability to move the shoulder increases. This stage lasts 6 weeks to 9 months. So again, guys, like I said, some people have frozen shoulder for like a year. They're doing cortisone shots. They're doing steroid injections and all of these things when really your body is going through the normal phases of wound healing, but it's not getting the help it needs to pump that swelling out of you and so you can pee it out, or back into you so you can pee it out. So when you're talking about, let's say there is like a micro tear, right? Let's say you were throwing a ball and you just kind of strained your shoulder and you woke up the next morning and it was like the joint itself was painful and you were doing things that inherently cause more swelling, like putting a heating pad on it. When it's already swollen, heat is a vasodilator. It'll increase inflammation. So you're putting more heat on it. So you're causing more swelling and fluid and blood being brought to the area. So it starts to feel loose because of the muscles. But then once that vasodilation calms down, it gets stiff and painful again because you just brought a lot of swelling to that area. And then let's say you're continuing to use it. Let's say you're not really, taking care of it, things like that. And swelling continues to increase. This is the freezing stage. The worst thing you can do is try to hang on something and pull at it or rip at it or stretch it. Because guys, it's not a muscle that's tight, it's swelling. That's causing it to start locking up in that joint. That's causing it to be tight. That's causing that pressure and binding up that natural movement. So the worst thing you can do with frozen shoulder is try to rip at it or stretch it or yank it and things like that. We are going to get into the portion where I tell you what to do for frozen shoulder, things that will help because of the swelling. But don't, when you start to feel like it's stiffening and freezing up, the last thing you want to do is start ripping at that joint or digging into it or rubbing it and things like that, really aggressively, because you will continue to create more swelling and worsen the problem. This is where we get into the frozen stage. In this stage, pain may lessen. So let's think about a swamp. Let's think about a lake, okay? It's the freezing stage of the lake where, and their terminology is a little off, but let's take a lake. Just follow me here. We have a lake and it rains and that lake fills up with water and it's overflowing onto the grass, right? And then as the rain stops, we now have a lake that is merging into the grass, and this is all inflammation, right? Into the grass, and things are like mud and stuff is starting to get into the lake, right? Usually, your body's normal process is that lake would empty into a river and the water would keep flowing, right? But if we are stopping the movement in that lake, it gets into the frozen stage, which is where all that water and stuff sits and starts to become stagnant and thick and murky, and it starts to solidify. This is how fibrosis happens. So your swelling in here goes from red and hot and painful where you can still move it to the frozen stage, which is where it's not red and hot and inflamed anymore, but that swelling is becoming thick and swamp-like, and this is where the freezing happens. So the frozen stage. In this stage, pain may lessen, but the shoulder remains stiff because there's no room for it to move, because it's so full, and because it's binding up all of the area that the lymphatics are in, that your lymph nodes are in. You're not getting any movement, so it can't drain. It makes it more difficult to complete daily tasks and activity. This stage lasts 2 to 6 months. So again, that swamp is starting to become a swamp. That fluid is starting to thicken. You're not moving, you're not pumping, there's no stimulation to get any of that fluid moving, so it starts to solidify in there and become not painful because the injury phase has passed, right? We threw that ball like, I don't know, let's say like 2 months ago, and it's been red and inflamed, and the inflammation starts to calm down, and you're like, oh, okay, this is feeling better, but like I still can't move it much. So usually what tends to happen is we start to go to PT and like rip at it or dig into it, starting that inflammation phase all over again, which is not a good thing. Yeah, you can move it, but it's inflamed, and now we have more swelling. And then as that inflammation calms down, that red hot inflammation, the swelling is still in there because nobody's doing manual lymphatic drainage. Nobody's addressing the lymph nodes. Nobody's draining that shoulder capsule back into the body. And it's becoming a bigger problem and more stiff. So this is how the frozen stage happens. The thawing or recovery stage. In this stage, pain lessens, the ability to move the shoulder slowly improves, full or near recovery occurs as normal strength and motion returns. This stage lasts 6 months to 2 years. Guys, that does not have to last 6 months to 2 years. None of this has to take this long. The one thing we are missing is the inflammation itself. Nobody is addressing the inflammation. Sure, they'll give you steroids. Sure, they'll give you, muscle relaxers and anti-inflammatory meds and all of that. But guys, the problem is not the inflammation coming in and being caused. The problem is that no one is addressing and dealing with the swelling that's there and getting it back into the body. Now, I do know a lot of times when there is that inflammation and swelling, one thing they'll do that I've seen, which I don't agree with, is aspirate. They'll take a needle, stick it into your shoulder joint, and suck out fluid. Here's the problem with that. Your body is using that swelling. The reason you inflamed to begin with frozen shoulder, your body is using that swelling to heal whatever happened in that area. The problem isn't the swelling. The problem is that it's not draining back into the body, is that it's not moving. Because that lymph node bed that would normally drain the swelling isn't getting any stimulation or movement the way it normally would. So now we're just sitting there with like this cold, dead swelling, and we're draining it out of there, but we're not actually getting the body to reabsorb any of it. So although we're sucking out that clear fluid and constantly draining the swelling, we're not dealing with in the capsule the swelling that's in there binding up all those ligaments and tendons that they were talking about that's causing that shoulder to be stuck. All we're doing is getting rid of the swelling that's underneath the skin. That's not the problem. The problem is the swelling in the joint itself. And I'm going to show you guys a picture to explain that. So, diagnosis and test. How is frozen shoulder diagnosed? Discuss your symptoms and review your medical history. Conduct a physical exam. The doctor will move your shoulder, range of motion. The doctor will watch you move your shoulder for active range of motion. The two types of motions are compared, and then they do x-rays to see what other problems are in the shoulder. That's it. And then medications, they usually give you painkillers, anti-inflammatory drugs, corticosteroids, like I said, steroid injections, physical therapy, stretching the range of motion, home exercise, nerve stimulation TENS unit. Again, guys, manipulation under anesthesia, surgery, arthroscopy. Your doctor will cut through tight parts of your joint capsule to release them. Guys, I don't recommend that ever. Please, if you have frozen shoulder and you're thinking about undergoing surgery, please set up a virtual with me or come to see me, because it is not necessary. That is not the problem. Now, and then it just talks about like how it can be prevented, and that's the end of the article. Now, when we're talking about what to do about frozen shoulder, we need to deal with the inflammation. The inflammation, and okay, So here's the thing, guys. When we talk about inflammation, you guys think red hot, I stubbed my toe, it's inflamed. You guys don't think about cold and stiff inflammation. You guys don't think about the complication of swelling where it's stiff and cold and thick and hard. Swelling will turn into adhesions, fibrosis, and then after all of that, then scar tissue. And what they're talking about in that surgery is cutting through the scar tissue part. That's because it's been 2 to 3 years and that swelling has turned to scar tissue. We have the lipofoams. We have ways with manual lymphatic drainage of getting your body to reabsorb those proteins to help get all of that fibrous, thick, sludgy swelling to reabsorb back into the body to get you that better range of motion. And to get your shoulder cleaned out by your body naturally cleaning it out. Your lymph system naturally cleans this stuff out on its own every day from everywhere in your body. The problem is not the thing itself that's happening and the inflammation that's happening and the swelling that's cold and stuck and stiff. The problem is your body's not cleaning it out. It needs help. Enter manual lymphatic drainage. This is what we're doing. We are manually moving the skin, dilating those lymph nodes and those lymph vessels to get it to suck all the swelling back out of that shoulder capsule up into your subclavian vein, back into your bloodstream, through your heart, your liver, your kidneys, and you pee it out like it should have been doing the entire time. Guys, the problem isn't that there's swelling. The problem is that the swelling isn't moving. That's the problem. You can take your anti-inflammatories till the cows come home. It's going to stop the making of the swelling, the inflammation process where the swelling is being brought in, but it's not going to move the swelling out. That's the problem. We can stop the inflammation from coming in, but whatever's in there needs to be reabsorbed back into the body and moved out. That's where manual lymphatic drainage comes in. We are manually dilating and stimulating your body's lymphatic system that already exists to do its normal job of drainage to the area. That's what we need for frozen shoulder. That's what everybody's missing. That's why this stuff is taking 2 years, 6 months, 3 months, 8 months, and getting worse. And it's literally impeding your whole life because you can't move your shoulder, you can't sleep, you can't do anything. So we have another article here from penmedicine.org, also just titled Frozen Shoulder. What is frozen shoulder? Frozen shoulder is a condition that causes pain in your shoulder. This pain usually prevents you from moving your arm, and the related lack of movement can lead to stiffness and even loss of mobility. Also known as adhesive capsulitis. That's probably why I was using the accent, because it was easier to say. As adhesive capsulitis, frozen shoulder is usually caused by inflammation. Ta-da! The capsule of the shoulder joint has ligaments that hold the shoulder bone to each other. When the capsule becomes inflamed, the shoulder bones are unable to move freely in the joint. Guys, literally, explanation. The problem is the inflammation itself. Most of the time, there is no cause for frozen shoulder. It is literally just inflammation. Though risk factors include diabetes, thyroid problems, hormone changes, shoulder injuries, shoulder surgery, open heart surgery, cervical disc disease. Why? Why are all of these things risk factors? Because all of these things like hormone changes, such as menopause, diabetes, thyroid problems, they are all extremely high inflammatory situations or risk factors. That's why. That's the end of the article. It was literally like 2 paragraphs. But again, guys, I want to explain to you a little bit clearer this whole inflammation phase. So let's say for whatever reason, let's say the cause is, like I said, a little injury, right? A little soreness. You were kickboxing and you threw your shoulder a little too hard, right? Or you were doing jujitsu and your shoulder got yanked, right? Inflammation is the start of it. Inflammation is the phase where your body sends in swelling so that it can heal the area. So it buffers, it protects, it inflates, it brings in proteins, white blood cells, fats, the extracellular mixture, it's called ECM, which is swelling, lymphatic fluid, to the area to heal the area, okay? That's not the problem. That's the cause of the frozen shoulder. That's the start of it. Then your body and your lymphatic system, 24/7, your whole life, happening every single area, inch of skin, every bone, every ligament, everything in your body right now, this is happening. Every time you pee, your body is lymphatically draining that swelling. So your body creates the inflammation, your lymphatic system gets rid of it. When we're talking about frozen shoulder, the inflammation process is not the problem. Your body inflating, the swelling coming in is not the problem. The problem is, for whatever reason, your body isn't taking down the swelling. That's the problem. The swelling isn't moving out of that area. The complication of frozen shoulder itself is diagnosed and becomes a complication when that swelling has sat in there for so long, it's becoming like Play-Doh and binding up the joint to the point where the bones can't move. That's the problem. That's the frozen shoulder, is the lack of lymphatic or swelling movement in the area, not the inflammation itself. So when we're treating frozen shoulder and we're doing these PT things where they're ripping at your shoulder, or you're trying to stretch it, or you're digging into it, none of that is addressing the lack of lymphatics, the lack of the swelling being absorbed into your body, that mechanical process that your body does of your body absorbing and like little sump pumps sucking swelling out for you to pee it out. None of those treatments are addressing that. Manual lymphatic drainage addresses that. That's why it works literally overnight incredibly for frozen shoulder. And we're gonna see why in a second. I'm gonna put these two pictures up here, then I'm gonna flip my camera around like I always do. Okay, so hold on. So these are the lymphatics of your shoulder. You see this joint right here? This is where the frozen shoulder happens. So this bone here, and this bone here, these are all just kind of floating. You have muscles that lay on top of this, like spider webs, that hold it in place, called your rotator cuff, right? It's a cuff of muscles that wrap around your shoulder to create stabilization and mobility for this joint. In that cuff, you have these green things. These are your lymphatic vessels. You see these little round beads here? These are your lymph nodes. Frozen shoulder happens in the joint itself, where these lymphatics are embedded. And it happens because the joint gets so inflamed. And the frozen part of the frozen shoulder happens when all of the swelling in here, these little beads aren't pumping because your shoulder's plastered to your side. So every time you move your shoulder, you pump these little beads and it drains your shoulder and it sucks it back. And it goes up into your collarbone over here to these little bed of lymph nodes, and then it goes back into your body. So when we're not moving this joint, when there's no skin movement, when these lymph nodes are not being stimulated and they are frozen and stuck in place because that shoulder is stuck in place and it's not doing its normal job of pumping, that's when it starts to become like a swamp and becomes really thick and really adhesed or stuck to your side. This is how the frozen shoulder thing happens. So when we're talking about treating frozen shoulder, these lymph nodes are in your armpit, literally in your armpit, and on your trunk, on your rib cage. There's also lymph nodes over here in your shoulder capsule, in the back here of your shoulder blade, in the back of your armpit, all across the top of your shoulder blade, into your first rib, and into your neck. So when we're treating frozen shoulder with manual lymphatic drainage, we're addressing all of these lymph nodes. This is where the frozen shoulder problem is happening, is inside the thing itself, right? All up in here. So when you're doing PT exercises and you're ripping and you're pulling, you guys aren't addressing any of this. And your lymph nodes are only a hair thick. That's it. They are thin little spider webs. They are a hair thick. All right, hold on. So how to fix frozen shoulder? Addressing it with manual lymphatic drainage. Now, I know this map is super, super tiny, guys, but if you see, and I have a picture of it on my Instagram, but do you see in here how all of this is lymphatics and there are lymph nodes all in this shoulder joint and in here as well, all up under here and all on top of here? Those lymph vessels are a hair thin. You are not digging and rubbing. If you guys literally take your hair and try to just pull it and stretch it and make it pump, that's what we're doing with manual lymphatic drainage. Without pulling the hair out of your head, that's how gentle and delicate it is. Now again, because of this map, and because there are certain pathways right now that are impeded because of the frozen shoulder, you have to find someone with manual lymphatic drainage that's going to be doing your MLD sessions that knows this science, that showed what I just showed you, that understands how to work this system. Because it's not something where you're just rubbing with oil. I have to find your shoulders plastered to your side. I have to be able to move the skin and reroute and move all this fluid up and out because I can't get to these lymph nodes. So I have to use this map and reroute your lymphatic fluid away from this area. So all the way over here, all the way down here, all up here, I got to employ all different kinds of side streets and highways to get that fluid out of that shoulder joint because you can't move your shoulder for me to get my hand in here to start using these lymph nodes. So it's a process, and it's a whole protocol. It's not as simple as I'm just going to rub this and massage this with oil. That's not how it works. Because yes, that may work for a little bit for the topical swelling that you have on the outside. Sure, if you just do this a lot, that may work if you rub with oil. But again, that's not addressing where all the swelling is on the inside of that joint. So if you guys are having problems with frozen shoulder, I do virtuals. A lot of, yes, you need the hands-on MLD part of it, but a lot of it too is your diet, things that you're doing that are causing more inflammation, like using heat all the time, like aggressive ripping movements, pulling, stretching, all of that stuff. There's a whole frozen shoulder protocol to address the stagnant, stuck, frozen, stiff swelling in itself that I work with. So if you guys need help with frozen shoulder, if you've had this for a while, or if you just had it and you're now starting to like look into, okay, what is frozen shoulder? What causes it? Like, how do I fix this? I've done PT. It doesn't work. I can't live my life. I need to go to work. Like, PT's not working. The steroid injections aren't working. Like, yes, I'm dealing with the pain, but I'm also dealing with the debilitating frustration of not being able to do anything or move my shoulder or live my life. And then when I do try to move it, the collarbone starts shifting because this joint won't move freely. So when you lift your arm, you should be lifting from here. If this is stuck, when you go to lift your arm, it's affecting your collarbone, it's affecting your lats, your rib cage, it's affecting your neck. You're gonna start getting migraines and headaches and all kinds of things. So getting that taken care of is the most important thing, is getting it, even though you're not in pain, but getting rid of it because it is so debilitating. So if you guys need me, if you need help, this is a little bit about frozen shoulder and explaining it. To wrap it up in a nice, cute, pretty little bow, as I always do. Frozen shoulder is caused by inflammation. And it's not caused by inflammation coming in or having constant inflammation. So taking those inflammatories, anti-inflammatories, is not going to do the trick. It's going to stop the pain, but it's not going to get you back your range of motion. It's caused by the inflammation that's stuck, the swelling that's stuck in the joint. The event that started the shoulder thing was an inflammatory event, but that's not the thing causing the frozen shoulder. The frozen part of the frozen shoulder, the thing causing the frozen shoulder, is the lack of movement to your lymphatic system. It's the fact that the swelling is stuck in there and isn't moving and isn't draining back into your body. That's the problem. The swelling is becoming stagnant, stiffening the joint, binding up everything. How do we fix this? Manual lymphatic drainage. We as therapists are manually pumping your lymphatic system, getting it to reabsorb and drain, doing its normal job of drainage back into your body so that you pee out all of that excess swelling that's getting stuck and stagnant. There is no movement in your lymphatic system right now. That is the problem, is that none of that swelling is moving and it's causing the stuckness and the freezing of the shoulder joint itself. So that's pretty much it. You need manual lymphatic drainage. You need to be drinking a crap ton of water every day because your lymphatic system, the vehicle by which those proteins move in your swelling is water. Swelling is not water. Swelling is proteins, white blood cells, fats, all the things that are meant to heal the tissue, extracellular mixture. The vehicle by which that moves in and out is water. So we need to be drinking a lot of water. You need to find yourself a manual lymphatic drainage therapist. If you need help, if you have frozen shoulder, if you're in New Jersey or if you're not in New Jersey, we have offices in New Jersey, Highland Park and Elizabeth. And then you can do virtuals with me and we can set up a frozen shoulder protocol for you so I can teach you how to manipulate that area and use the lipofoams, because the lipofoams, So here's a quick tip before I end this video. The lipofoams. If you take one of our foams, right? And let's say you're a lady and you're wearing a bra, or if you're a guy, get like a strap or something. You take a foam, you fold it, and you either put it vertical or horizontal. And I know you guys can't lift your arm. I know that. So if we can just like floss it up in between here and go about your day, the foam creates a microstimulation to your skin. Make sure it's touching your skin. The foam creates a microstimulation to your skin just by touching it. Anytime you breathe and expand your rib cage, this foam is going to pump against your skin, stimulating those lymph nodes that are getting no movement and are trapped under there. So this is going to be your best friend for frozen shoulder. You can get these in our post-op shop, amarepostopshop.com. In the virtual, I will teach you how to place these. I will teach you how to put them. I'll teach you how they work. But basically, this is how they work. So the foam is on the skin, right? All I'm doing is placing my hand on the foam. I'm not squeezing, I'm not doing anything. I'm placing my hand on the foam. When I move the foam, you guys can see, I'll even use 2 fingers. You guys can see how my skin moves. 2 fingers barely moving the foam, and it moves. And then when I do this, all the skin moves. Guys, I'm using fingertips. I'm not like pressing or anything. I'm just holding the foam to me, and the foam, anytime it moves your skin. That skin movement is exactly how your lymphatic system pumps. That is the exact pressure and exact degree of what we need right now. So if you've had frozen shoulder for a really long time, you need to get yourself a pack of these, and you need to fold it, and you need to put it in here, like wedge it up in as far as you can get it, even if that means just down here, because it's still gonna pump those intercostal lymph nodes. If you can get it up a little bit higher, that's great. We'll get the axillary lymph nodes too. But this is going to help get rid of your frozen shoulder. This is what's going to get all of those thick fibrotic proteins to start turning back to water so that you can pee them out. So get yourself a pack of the lipofoams, Amare Post-Op Shop. In the virtual, I will teach you how to place them specifically for your frozen shoulder. Not everybody's frozen shoulder is the same, guys. But if you are in New Jersey, you can just come in and I'll custom do the foams for you, set you up on the whole protocol with compression and stimulation so that all of that thick adhesive swelling starts turning back to watery swelling, and then you can pee it out. So if you need me, first of all, you can get your foams, amarepostopshop.com. It'll be linked in the description box. If you need me, if you are struggling with frozen shoulder and PT is not working, we can help. 732-841-0142 is the office number. You guys can set up a virtual in-person with me in New Jersey where I can actually be your therapist and work on you, as well as set you up on the Amare protocol for frozen shoulder, or virtually, where I can still do the same thing and we can find you a therapist if we need to in your area, if that's, what we're putting in your protocol. But that's a little bit about frozen shoulder, guys. It's really not as complicated as it seems. I mean, I read both articles. I showed you the science. Guys, it's really, really simple. The problem is the inflammation that used to be inflammation. The swelling that used to be red hot inflammation and pain is now stiff and stagnant and cold and dead. And it's freezing up in your shoulder. And we need to get all of that inflammation reabsorbed into the body, or swelling, old inflammation. We need to get all of that reabsorbed into the body so that it stops binding up the ligaments, tendons, and bones. That's all it is. Like they said, the injury is a separate thing. The injury can cause frozen shoulder, which is a separate thing, but the frozen shoulder itself, the problem itself, is not an injury. It's a condition. It's a complication of swelling. So guys, I really hope this was helpful. I'm so passionate about this because it's so simple. Guys, it's so simple. Oh my God. It's so simple. And it goes away so incredibly quick once you have the right tools, once you're addressing the lymphatic system, once you're on the right path. So I really hope this helped. I will see you guys soon. You know where to find me if you need me. Ashley with Amare. Bye.